Hi guys, this is Preeti and you're watching Med Solution. In this video, we'll be learning a clavipectoral fascia. Clavipectoral fascia has been asked as RS2 and 3 question. This is a short answer. This has been asked as a short essay and short answer, which is a 5 marks and 3 marks. It extends from clavicle above to the pectoralis minor muscle, and it encloses two muscles, subclavius muscle and pectoralis minor muscle. You can see here this encloses subclavius. Sub means below, clavius means clavicle, like the below the clavicle, the muscle will be subclavius muscle, and pectoralis minor muscle, it encloses these two muscles. This is a clavipectoral fascia. And the other things we'll speak of. This is an investing layer of deep cervical fascia, which is the fascia of the neck, and then it splits into two lamina, and it is attached to the clavicle. Below this is the clavipectoral fascia. This is clavipectoral fascia. Above it splits into two lamina. This is anterior lamina. This is a posterior lamina. Anterior lamina, it is attached to the clavicle, whereas posterior lamina will be continuous with investing layer of deep cervical fascia, and below also it splits and encloses other muscle, that is pectoralis minor muscle, and from there it continues as suspensory ligament of axilla, which is attached to the axillary fascia, which helps in maintaining the dome shape of the axillary fascia. And pectoralis major muscle, it is attached to the clavicle. The fascia above the pectoralis major muscle will be pectoral fascia, and it becomes continuous with the axillary fascia. This is the anterior axillary fold. This will be the sagittal section of clavipectoral fascia. Coronal section will be this thing when we see from the front. To the medial border of the coracoid process, pectoralis minor muscle will go and insert. From the tip of the coracoid process, there will be origin for two muscles, that is medially coracobrachialis, laterally short head of biceps brachii. This is the clavicle bone. The ligament between the coracoid process and clavicle will be coracoclavicular ligament, and the ligament between the first rib, that is cartilage part of the first rib, and the clavicle will be costoclavicular ligament. And below the clavicle, this is the subclavius muscle, this is the first rib, this entire thing will be clavipectoral fascia. This is the sagittal section. We'll see the theory part of this, as we have discussed in the diagram. Vertically it extends from the clavicle to the axillary fascia. Already we have discussed from clavicle to the axillary fascia. This is a clavipectoral fascia, and it encloses two muscles also. We have discussed, that is subclavius and pectoralis minor muscle. This thing, its upper part, it splits into two lamina and encloses subclavius muscle. See here, it splits into two lamina, anterior lamina, posterior lamina, and encloses subclavius muscle. Anterior lamina is attached to the clavicle. Once again, anterior lamina is attached to the clavicle muscle. Posterior lamina will be continuous with investing layer of deep cervical fascia and blunts with the axillary sheath. Posterior lamina continuous with investing layer of deep cervical fascia and gets fused with the axillary sheath. Lower part also splits and encloses pectoralis minor muscle. This upper part, this is lower part, it splits and encloses pectoralis minor muscle. And then below it will be continuing as suspensory ligament of axilla. This part is suspensory ligament of axilla, which maintains the concavity of the axillary fascia, it helps to the dome shaped axillary fascia and keeps dome shape up, that is, it maintains concavity of the axilla. Medially, it is attached to the first rib. As you can see, medially, this is the medial side, this is the lateral side, it is attached to the first rib and costoclavicular ligament medially. Laterally, it is attached to the coracoid process and coracoclavicular ligament. Ligament from coracoid process to clavicle will be coracoclavicular ligament. Medially, it attached to first rib and costoclavicular ligament. It blunts with there will be two muscles in the intercostal space, that is external intercostal muscle and internal intercostal muscle. The fascia on external intercostal muscle will be the membrane of external intercostal muscle. It blunts with membrane on the external intercostal muscle, and laterally it is attached to coracoid process and blunts with coracoclavicular ligament. Laterally it is attached to the coracoid process and blunts with this ligament, that is coracoclavicular ligament. And this thicker part of this fascia from first rib to the that is the upper part will be thick from here to here. This is called as a costocoracoid ligament. From first rib to the coracoid process, costocoracoid ligament. And structures piercing clavipectoral fascia, there will be four structures which are piercing the clavipectoral fascia. They are lateral pectoral nerve, which is a branch from lateral cord of brachial plexus, thoracoacromial artery, this is a branch from the axillary artery which supplies thorax. Lymphatics that is drained from the breast into the apical group of axillary lymph node. There are so many subgroups from axillary lymph node, that is anterior, posterior, lateral, central and apical. Apical is a major group. From here to the it drains into these lymphatics inside after piercing the clavipectoral fascia. Cephalic vein from the arm, from the forearm and then into the arm, then finally pierces the clavipectoral fascia and drain into axillary vein. As you can see the structures piercing: thoracoacromial artery from the axillary artery, cephalic vein from the will be drained into axillary vein, lateral pectoral nerve from the lateral cord of brachial plexus, lymphatics of the breast. Here will be breast. This is a clavicle. Pectoralis major muscle, pectoralis minor muscle. Fascia covering pectoralis major muscle will be pectoral fascia. It will be continuous with the axillary fascia, and this is a dome shape of the axillary fascia. This is a suspensor ligament of axilla which helps in maintaining the concavity of the axilla. This is clavipectoral fascia, anterior lamina, posterior lamina. It encloses two muscles, subclavius muscle and pectoralis minor muscle. This anterior lamina is attached to the clavicle. Posterior lamina will be continuous.